So on your ABC interview with Matt and Dave, you said that it was a local newspaper issue. Do you stand by that?
Well, I think it is, and I think the facts are demonstrated by the way that the Messenger has run this issue. Didn't say it in a pejorative way. It is a local issue. There are a lot of there are a lot of smaller hospitals servicing various communities, which are also served by local newspapers, who quite rightly are interested in those issues. So it fits in with the purpose of suburban community-based newspapers. And the facts are, of course, these newspapers, the Messenger newspapers, have been running petitions and have actively said we are campaigning on this issue. So they've created the stories which they then cover. So they're very intimately involved in this issue. It absolutely suits the purposes of local newspapers. So I'm not sure why Messenger might be upset that I would say what is bleedingly obvious. Well, look, I understand people don't want to pay for something that they used to get free. I mean, that's obvious. You don't have to be a genius to work that out. But we run a health system which is very expensive and provides services to a vast number of people, and we have to manage that service as best we can. When the global financial crisis occurred, it put pressure on our state budget, and we had to make some savings in our state budget. Now, health, which takes up 30% of our state budget, couldn't be protected from that pressure. So the options I had was to included reducing services or charging for something which used to be free. I haven't ignored people. I know what they're saying. I just say to them, if the choice is paying a small car parking fee occasionally or having reduced services, which choice would they make? But running free car parking isn't a health issue, that's a transport issue, if you like. People don't get free buses to the hospital, they don't get free trains. Nobody objects to that. So I don't think the logic is really there. A member of my family who's in the hospital at the moment, where there is car parking, and I drive there, my family drives there, and we pay the car parking fees, as do other people who visit patients at that hospital. I mean, Flinders Medical Centre, for example, has paid car parking, has had it for years. That hasn't stopped, to my knowledge, patients being visited by family and friends.